people, which all of them were reps and us.
I told her to host it.
What does that mean? It got off. It's phone died. Can you help him get back on?
No, I can. I'm doing it now, but everyone that was there was kicked off.
Hold on, I'm gonna put you on speaker. Here. Warren, here.
There's nothing to speak about. What can she do about it?
You said the link doesn't work.
There's no link. I have to start a new one. It's dead.
Everything you did saved though, Tess, so all that is saved.
Yeah, it just looks like crap. It's Scottsdale Weight Loss Center? I'm doing.
Yeah.
We need a streaming service, and we need to get this done better. Because you can't do it on computer. It won't let you do it if you don't have a streaming service. We have to be set up professionally for this stuff. Hey.
Okay, I'm back.
Yeah, sorry about that. That was abrupt. Little power shortage. Sorry
Okay,
about that.
well, technology. So I was chatting a little bit about what happens after people have lost weight from the medical piece. And, we put people in a program we call active maintenance, right? Once you've lost weight, weight loss required a plan, weight maintenance requires a plan. So there are certain things we know that are highly effective in keeping off the weight. So we design a meal plan that's within their calorie budget. But one of the biggest problems we have is people try to stop their GLP-1s or their other medications too quickly, and they
Yeah.
wonder why they didn't keep the weight off, right? So if you lost the weight with a medication, there's a good chance you're going to need at least some medication to keep that weight off, because our body always fights to regain. As I mentioned before, leptin levels are low, ghrelin levels are high, and their physiology is such that their body will always try to get up back to their lifetime highest weight. So the weight loss is the treatment, and the surgery is, to help so that when they're at their normal weight, they look better, feel better, better self-esteem. But it's going to be really critical if to come up with a maintenance plan, and that's really where they need to be followed by a medical clinician, a doctor, nurse practitioner that also really understands weight maintenance,
Well,
weighing every day. Yeah.
I think it works both ways. I think for even people that come see us for cosmetics, they have a cosmetic interest, right? And they have something that they're dissatisfied. They have a cosmetic interest, and so you can do the surgery, but what's going to get them to the final satisfaction that they have will be the long-term results. And part of the long-term results is that maintenance. It's like when you were talking about who's a candidate, I was thinking, what about people who are, younger, they're in pretty good shape, but they're having increasing trouble maintaining. And it's almost like, with your courses and your classes and the lectures and how you're guiding them, it's almost like a coach, just like if you had a personal trainer. If you have a good personal trainer and good relationship, some people will stay with them for decades. Like they're not
They
going
need
to leave.
accountability, right?
Yeah, they need accountability. And so,
Mhm.
even someone coming in for a tummy tuck that would never had a BMI above 30, right? I think that you clearly are concerned with this. It's clearly something that you value. Why not get a coach? People get coaches for doing bench presses all the time, but they don't get a coach for the more important thing, which is what's going into their body. Like even competitive fitness models and competitive athletes who are at the gym will say that nutrition's 80%. But no one has a problem getting a personal trainer for the 20 to 30% of the value that gives you, and then they ignore the 70%.
As far as the timing of surgery, should they wait until they're at their goal, or do you encourage them to have their procedure prior to their reaching their ultimate goal weight?
It depends. So for someone like our patient, and we've done videos with her, and she's been on the news, she's been on Fox News, that we did the cryogenics where we took her fat, froze it, she lost her weight. Then we were going to do afterwards because This was going to be a volume issue, that we knew that we were only going to be able to see that deficiency once it was done. For a lot of patients, like they'll ask me for let's say a mummy makeover or a tummy tuck. And so a woman will come in and say, I'd like to get a tummy tuck. And guys too. I mean, we get more and more males coming in all the time. And they'll come in, they say they want that. They're like, well, should I lose weight first? I'm like, but if you do this and we restore your core and we get rid of overhang of skin, you're going to be more comfortable. You're going to be stronger. You're going to be able to do more. Your VO2 max and your steps are going to go up without you even knowing it. You've already adapted to the weakness of your core. You've already adapted to the extra skin or the extra fat that's there, right? You don't realize it because we're very adaptable creatures. When we restore that, you're better off. So I don't think that they should necessarily wait. If it's someone who's about to lose 120 pounds, yes. But if it's someone who's going to lose 34, I see where the excess skin is, right? Like if someone's lose 60 pounds and I take out enough that it's like it was the equivalent of like someone who lost 30, 40 pounds, that extra 10, 20 pounds is not going to cause their skin to be extra. And I tell them afterwards, I said, listen, if you were so good that after I did a mummy makeover, that you lost an additional 20, 30 pounds and you have a little extra skin, you've done me such a service by being so involved in your care. They make me look good when they do that. So I said, if you do that, you come in and I'll do the nip tuck. I'll do the adjustment. You don't worry about it. I'll do the adjustment. That'll be my reward to you. Let that be incentive to you. If you want to lose the extra 30 pounds and you want to look amazing and that you make me look amazing, I'll stand by you on that journey. So I don't think waiting is necessarily the best. Rob, these are all individual questions that it's obviously is patient specific, but in general, if you're thinking of something and remember, things look good because they work well. It's not random. We don't just cosmetics is not just beauty's in the eye of the beholder. A six pack is a weird thing to find attractive objectively. It's 6 bumps, but everyone finds it attractive because it's a sign of physical fitness. That's what it is. Why it's attractive. So most cosmetic surgeries have a physiologic component to it. It's restoring functionality, and that's why it looks good. We're not in the business of altering people. We're not trying to create cosplay characters. This is not anime in our office. What we're doing is we're trying to restore the functionality to people, and as the bonus, they look good. As the bonus, right? They came looking good, but what they don't realize is that to make them look good, I'm not doing a cosmetic procedure. I'm doing a functional procedure, and that's going
I
to make
think
them look better.
I think the moral of the story is whether you're talking about medical weight loss or surgical treatment, that every patient is different.
Mm-hmm.
And that's why you want to see a medical clinician, because you need someone who has experience in the journey, right? You have a heart problem, you go to a cardiologist. You have cancer, you go to a cancer specialist. You have a cosmetic issue, you go to a plastic surgeon. You have a weight problem, you go to an obesity medicine specialist. And then coordinating all these pieces is really where you get the most dramatic results. And
We
that's why it's been great working with you, because
we try to
we're
send.
all on the same page. Yeah.
It's fun. We have a hard time. We try to send people to you all the time, and even incentivize them to do it. Some might find it as an insult, which I don't understand why, because you're here in the first place, right? So i me acknowledging a problem that you have introduced should not be an issue. The second is I think they still think it's a will thing. Like, no, 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 we'll just do it on our own. I was like, really? When are you going to do it on your own?
Fortunately, that's gotten better, right? People are
They're
understanding
more accepting now.
that they're more
Hmm.
accepting. One in 9 people are now on a GLP-1 medication, and that is astounding. Now, most of
Hmm.
them are just kind of doing the drug on their own, and that is where, unfortunately, the problem is going to come in, because they're not going to know how much to take, how long to take it for. The biggest thing we see is side effects, right? their side effects aren't well managed. So they complain that they're nauseated or having constipation or diarrhea, when all they need to do is be on the right dose and be on the right meal plan. So it isn't
Are,
difficult to do, but that's something that they're not getting from an online supplier.
aren't we also worried when people are doing it through mail-ins, which I didn't even know, I don't even know how this became a business,
Well, I mean,
But
would you treat cancer or depression that
no,
way?
it's
Would you
It's
just
crazy. But
yeah,
the
yeah.
impression is my question. People who do take this or take it wrong, are we worried about like that anhedonia, the loss of motivation, sometimes loss of pleasure, depression in these patients? If you take out your dopamine centers, if you take out your pleasure control centers, right? There's a lot of other things that can spiral quick.
People feel depressed and tired if they get too much. So there's a very narrow window, we call it a therapeutic window, between getting just enough and not too much. And the difference may be between 5 milligrams and 7.5 milligrams, this very potent medication. So it's really important that you're monitoring the patient and you ask them, how are you feeling, right? I mean, there are some great benefits to GLP-1s that go well beyond just the weight loss. Less heart disease, less cancer, less arthritis, less dementia,
Hmm.
less kidney disease. So we're seeing all these great benefits. The longer people are on them, the more medical benefits we're seeing. However, and less drinking, less drug use. However, absolutely, if you're getting too much, you're either going to be nauseated or tired or not eat enough and lose muscle, or anhedonia, lack of reward, right? It's a little too much of a good thing. So it's really important that
You need balance.
you don't just go down to Mexico and pick up a pill and or a shot and decide on your own how much to take it, because you just don't have the knowledge, the experience, and the awareness of the potential side effects that are really easily managed if you are just monitored medically.
There's a good question here. What advice do you have for someone just starting on their journey? I, I, I don't want to sound, from my perspective, I would say my advice is to start. Take that first
Absolutely.
step. It's a lot easier than people think. Just take the step. It's, people think that they're doing it and they have to like pull all nighters and study for finals and before they can get anything. No, no. Just take the step. It moves on its own. Even when I went to you, it was seamless.
The biggest regret that I hear from people is, I wish I'd started last year or the year before that, because I wouldn't be in this situation right now. I would have been at my goal. So I think the hardest part is making the call. And time after time, we ask patients, how has this experience been for you? And they've been on, a dozen or more diets. And what we hear over and over again, even after a week of treatment, is that this is much easier than I ever would have expected. I wish I'd started long ago. And I think just because there's so much kind of snake oil associated with weight loss, and there's so many fad diets, that people are really wondering, is this just going to be another fad? Um, and that goes to cosmetics, right? There's so many online treatments that are going to get rid of wrinkles, and people really don't understand what they're doing. Or they're thinking, if they're, some exercise machine is going to get rid of all their belly flab or the saggy skin, and as you know, that's never the case. It's all promise.
Yeah, and I think, listen, transparency in this new age of lack of control of information. Let's say it that way. It's just people are just getting inundated, and some people are very convincing. It's not that anyone is dumb. Everyone's very smart. It's just there's a lot of messaging. I think the key is transparency and respecting the client's own intelligence. Meaning, I would talk to them like I'm talking to a first year intern that wants to do the residency and wants to become a plastic surgeon. If the algorithm makes sense to a first year surgical resident, as someone who's already graduated med school, it should make sense to them. in in my mind, the way to treat it is transparency and through really treating someone as an intelligent person that is the ability to get it. And I think that's self-evident when you talk and you break down what you're saying. All right, like if you have a high blood pressure and you're taking medications and your blood pressure is controlled, that doesn't mean you had high blood pressure. It means you have high blood pressure now, but it's controlled. So why would you stop the control?
Yes.
Right? Why would you stop doing something that's doing what it's supposed to do?
So
Like,
if someone wants to get started in their weight loss journey, we're in Arizona. We treat patients throughout Arizona. So reach us at scottsdaleweightloss.com and give us a call. How do people get started and get an opinion from you? And is there a fee just to have you look at them and get an opinion?
yeah, we have a very small consultation fee that we would reimburse or put it towards anything else that they would want. Most of that is just to promote accountability. Um,
They
you
show
know,
up.
to show up and not because we want money for them to show up, is that we believe in what we do so much that we think it will be a great service to them to just, as you said, put that first foot forward and then see where it takes you. At least get the information.
And they're paying for your professionalism and your opinion. And uh, there are also people who are going to come to you that really you may tell them, you know what, that you should not have surgery because that's not
All the
necessarily
time.
the best answer. So, true surgeon is someone who does a great job in the operating room, but also knows who to not
Well,
operate
well,
on,
this
right?
both of us, we have businesses in medicine, and I did my MD MBA, and there's always been a conflict between medicine and capitalism. There's been an uncomfortable kind of union or acceptance, and I don't think they're necessarily incompatible. Right? It goes like this: we're doctors first, and once that's out of the way, then capitalism can come into play. Then we can advocate for value and what the value is. But advocating for value is completely disconnected from the medical opinion.
Yeah.
Right? And maybe that's the Canadian me because uh, there was no difference between anyone walking in the door. Um,
Do you have any final words? I'm sure. I'm sure you probably have some take home message that you want to impart on
yeah,
your potential patients.
I think these are empowering things. I think the hardest thing is for people to believe that they deserve to get what they want because they've been told for so many years that it's their fault and they don't deserve it. And they can get it now and they do deserve it. 1 out of 9 people didn't just develop willpower. Right? They need to be aware and I just think, these services are very empowering services and whether they come to me or go to someone else or they go to you or they go to another professional, right? Obviously, I like myself and I'm sure you like your services too. We wouldn't have done it if we didn't feel strongly about it. But what's available for people to improve, the quality of their life that they thought beforehand was unavailable is now available. And I would just hope that any kind of push to inspire them to start on that journey, I think would be worthwhile for people. I think it's a tremendous benefit for them and for their families.
Yep, that's awesome. Don't try eat less, move more.
Yep.
We know that doesn't work. And I think your point about, you really deserve to be at your best health. Back in the 50s, if someone had cancer, and this is before we had good cancer treatment, if you didn't have a cancer that could be surgically removed, then people were often they were banished
Hmm.
and they were ostracized by their friends and family. People were thinking maybe if I see this person, I could catch cancer.
Yeah.
So they died a very lonely death. Well, now when you go through cancer treatment, you're a hero and we ring a bell. But we're we're emerging out of it, but we're still kind of a point where getting treatment from obesity is kind of a lonely journey. And you really need to be supported by your friends and your family and by medical
Yes.
professionals who understand and have the empathy and create a safe space for you. So I look forward to the day where people with obesity who get treatment are also called heroes. So
We're
that's my
moving.
wish.
We're
Yeah.
moving.
Well, this was fun.
Once again, very, very fun.
Cool. Well, thank you for having me and love to
Thanks
do
for,
this again.
yeah, let's do it again. Thank you so much. That was great.